It is American Heart Month, and did you know that Methodist Hospital Texan is the first hospital in San Antonio to receive the highest rating by the Society of Thoracic Surgeons for open heart surgery? Joining us now is Dr. Renata Ford, who is a robotic, minimally invasive, and conventional cardiac surgeon with Methodist Hospital Texan. Welcome. Good afternoon, doctor.
Good afternoon. Thanks for having me.
Oh, most certainly. Okay, one form of heart disease is coronary artery disease. What is it and what are the symptoms?
It's when the arteries that give blood supply to the heart, they start getting blocked and you don't receive enough blood. So if you're not receiving enough blood and you're exercising or doing sometimes even just eating, you can have some discomfort or some different symptoms. Also, when you don't receive blood to the specific area for a long time and you don't have that looked at, then that part can die off. And that's what we call a heart attack or myocardial infarct. As for symptoms, some patients wait until they have a crushing pain and it's just terrible. But I think we lose a lot of time for patients that are not just saying, okay, my life is normal and this is changed. So anything from that is changed from baseline, from chest pain to discomfort. Some patients say, I have a stomach ache. It feels like I have an indigestion and they burp and I get better. Back pain, headaches, so it can be different symptoms. More so for women, it can be even more atypical. So I think everybody that has a history, they should pay attention to their body. If it's different, they should look for a doctor to check it out.
So how is it treated?
There are different ways. The treatment to reverse the disease is really, you have to go to the source to change what you're eating, lifestyle changes and all. When we go to a doctor, it's basically to bring more blood to your heart. So there are different ways to do that. You can do a stent, you can do surgery. The goal is to give more blood to the heart so that part doesn't die off.
So Texan is the only hospital in San Antonio to get the top rating by the STS. How is your program different from other programs that are in the same rating?
The collaboration. We really were pioneering the heart team evaluation. So every patient that comes in sees two heart doctors, cardiologists, and a surgeon, so that nobody's trying to pull to their side and say, oh, you're a good candidate for this or you're a good candidate for what I do. Some people say that if all that you have is a hammer, everything you see looks like a nail, right? So we try to avoid that so everybody can see, okay, I think this would be good for this patient, would be good for that. And some patients are not good for either therapy, but we see, okay, what is the least troublesome for this patient? What's going to give the best quality of life? And then the ICU, the nurses are very capable and very caring. The post-op care, we have an intensivist that is there and does a team rounds with all the nurses, PT, rehab, and it's a really team approach to everything.
Great information, doctor. And for more information about this service at Methodist Hospital Texan, visit sahealth.com or call 210-575-0355.